Okay, good afternoon. I am Heather Bell. I am the President and CEO of the Orange County Chamber of Commerce. And I'm excited today because we are going to welcome Ed Kowalski, and he is the HR Director for Ethan Allen Workforce Solutions, as well as Tom Lemmy, who is the Director of Sales. And today we are talking about post-COVID-19 issues, data and trends for employers to understand. So with that, I will give it to Ed. If you have any questions, go ahead and raise your hand or throw them into the chat box, and this will be an interactive conversation. Ed, it's all yours.
Thank you, Heather, and thank you everyone for joining us, and thank you to my colleague Tom Lemmy for helping on the technological side of this presentation. As Heather has said, I'm the Human Resources Director for Ethan Allen Workforce Solutions. We operate in the Dutchess County, New York area. And as we were just talking to Heather, it has been an extremely interesting year that we have all gone through and continue to go through. What we hope to be able to do today is to give all of our participants an overview in terms of what COVID-19 means retrospectively and proactively as we look forward. To give everyone just sort of a little bit of an anecdote, I've done this presentation to a number of chambers in the New York State area, and this particular presentation had to be updated about 7 times since Heather and I first spoke about doing this for your chamber, primarily because things have been moving that much more quickly in terms of what New York State is currently doing, what some of the feds have done. And some of the information as recently, this last presentation, or the presentation we're going to be walking folks through, was updated as recent as last Wednesday, and there's even more updates that I'm going to be talking a little bit about in terms of what's going on. So it's been pretty interesting. So with that being said, Tom, can you advance to the next slide, please? Once again, we're talking about data and trends for employers to understand post-COVID, and it does sound good to be able to use the word post-COVID now. So next slide, please. We hope to be able to accomplish a little bit of guidance and best practice to avoid COVID-related litigation. We want to talk a little bit about some of the strategies for defending COVID lawsuits should you begin to see them or dealing with them now. And we're going to be talking about really what the data means. Interestingly enough, since COVID began, where we were last March, the very first workplace lawsuit that was promulgated due to COVID-related issues came actually out of Texas. And it was an airline pilots union that basically sued their employer in terms of being able to have their pilots travel internationally into areas or countries where COVID was beginning to spike. That was the very first employment litigation claim that was promulgated. Since that time, if we go to the next slide, Tom. We're now seeing over the past year, there's been a 43% jump in COVID-related workplace claims that we want to be able to talk about. And what we've tried to be able to do is make sense of this for everybody along the areas of what types of claims are coming up, what types of claims are more prevalent than not, than others, where the most claims are happening. And this sort of slide captures what we're talking about in terms of really the top, 10 or so reasons that that employers are now seeing COVID-related litigation being promulgated. Next slide, Tom. This is a little bit of the tail of the tape. Surprisingly, California is leading the way in COVID-related litigation claims that are filed. Now, these numbers represent claims that are filed both in federal and state court, if you will. Not surprisingly, New York is in the top 4 position in terms of those claims. And as I said, this was last updated as of Wednesday. If I were to update this again, we'd probably see a little bit more of an uptick in regards to what those claims are, or the numbers of those claims. Next slide, Tom. The highest number of claims throughout all of the United States are revolve around these issues. Remote work and employee leave issues continue to be the most promulgated claim on both the federal and the state level. Retaliation or whistleblower claims, unsafe workplace allegations. We're going to come back to that a little later on in terms of some of the things that New York State is now requiring employers to have in place specific to compliance with what's called the HEROES Act. I'll get into that a little bit later on. Employment discrimination, wage and hour matters, and wrongful discharge claims. So these 6 areas or buckets, if you will, of claims by type really show what employers have been grappling with since COVID's been with us. Next slide, Tom. Surprisingly, the number of claims broken down by industry show healthcare being the #1 industry that the most amount of claims are being filed for, followed by retail, manufacturing, government, and hospitality. Next slide, please. Here's an interesting statistic in terms of, depending upon your size, 35% of all claims that have been filed based upon that data that we've been tracking since last March, 35% of all COVID-related employment litigation were filed against employers with less than 50 employees. 65% of those claims were filed against employers with less than 500 employees. So this is a problem, and this is a situation that size does not protect clients. Sometimes a client may say, well, I'm only a 20-person firm. I'm doing the best I can. That's really not a defense. Next slide. When we say employee leave and remote work requests, as you know, the Families First Coronavirus Response Act, or otherwise known as the FFCRA, allowed for individuals to take paid leave for COVID-related issues, whether that was for themselves or for family members or for children who are currently in school. We're seeing a lot of those claims continue to be made by employees who feel that their requests for COVID paid time under the FFCRA were denied, or employees who were terminated in response to requests for leave under the Act. As everyone knows, the benefits that have been paid under the FFCRA, which is the federal program, have been continued to be extended. The most latest extension for the FFCRA paid benefit for COVID-related pay is scheduled to expire at the end of September. I don't believe that we'll see another extension on this, because even from our own perspective here at Ethan Allen, for the claims that we've been monitoring for our clients, we have not seen, for the last couple of weeks, we've not seen any COVID-related claims being made. Although the most recent extension for COVID-related pay claims actually was increased to include paid time off for vaccinations, as well as for recovery from vaccinations. And we're even, as the numbers of the vaccination, as the number of the vaccinated employees have increased in New York State, we're even seeing a drop off on those claims being filed as well. Next slide, please. These are actual claims that have been filed. I'm not going to go through each of them to read them, but obviously the presentation covers them. It literally shows sort of a little bit about the types of filed claims under the category of remote workplace is being used here. So this shows a little bit of some of the claims that are currently still working their way through the court system in the jurisdictions in which they were filed in. And these two, the first two are New Jersey related claims. The last claim is a Connecticut related claim. But these give a little bit of a flavor for what some employers have been dealing with. Next slide, Tom. Discrimination claims, and again, coming in from all over the country. Discrimination claims are arising out of COVID-related layoffs, and literally are as I've written here, are wrapped up as classic workplace disputes that are wrapped up in a COVID context. First claim out of Indiana was an individual who felt that she was temporarily laid off because her automotive production manufacturer closed. She was not called back to work because of her age. And the second claim in Ohio, same thing, was an older employee being terminated who was replaced by a younger individual who was recruited to fill their position due to a COVID-related reduction in force. Next slide. We have begun to see discrimination claims revolving around pregnant employees. And more importantly, you're going to see now in some of these bullets, the issue of the accommodation requests. And I'm going to spend a little bit of time in regards to making sure that everybody as an employer understands their obligations specific to the interactive process for accommodations as workers return to the office. So we'll get into that a little later on in the presentation. Next slide, Tom. One more. Retaliation claims. Retaliation or whistleblowers claims are being filed by employees in a number of scenarios. In New Jersey, and by the way, we've seen a lot of this in terms of employers who are dealing with employees who are concerned about issues about social distancing. This employee next to me is not wearing a mask. The workplace is unsanitary. Same type thing again in an Ohio federal court, alleging that the employer provided inaccurate information or about their eligibility to use paid sick leave under the FFCRA. In New York, by the way, we have the added wrinkle of New York State having their own COVID-related pay program, and the coordination between the federal, as is typical in New York, the coordination between federal-related benefits as well as state-related benefits are particularly murky, even more so in terms of being able to figure out COVID-related leave and pay. The big difference between the two is that the FFCRA program allowed for an employer tax credit for payments made under the FFCRA, whereas the New York State program does not allow that same type of tax benefit. We've been advising, and we certainly have advised clients to, if they have been participating in the FFCRA program, to continue with participation in the FFCRA program, even through the most recent extension, which, as I said earlier, is the end of September. Next slide, Tom. How are COVID-related claims different? Well, in some areas, as I said, they're very similar to typical discrimination claims wrapped around a COVID theme, if you will. But this slide, in effect, summarizes how these claims are different. As I said earlier, smaller employers are not immune. specific to being 50 or fewer employees, where again, under the federal threshold for family medical leave, an employer would be exempt from being able to offer family medical leave, the family medical leave time, but not under the FFCRA. Claims can come through days after the adverse employment action as opposed to time to file. They can come quickly. Employees do not need to exhaust administrative processes. Claims are costly. And here's something that is very important to understand. Individual managers, as opposed to their employers, individual managers and employers can be sued individually under the FFCRA. Next slide, Tom. How do we avoid these claims? Well, we could probably spend a couple hours talking about this, but these are just sort of common sense areas. Make sure that if your organization doesn't have a leave expert, whether that be in the form of an in-person or an outsourced human resources team, you should try to get one. You should try to always have one. Train your management team specifically in terms of keeping abreast of the ever-changing regulatory environment that we're all operating in. Again, this is the second time we're going to repeat this. Understand accommodation obligations, and more importantly, understand the documentation of the accommodation process. When somebody comes to you and says, listen, I need an accommodation, whether it's for a back injury or whether it's a COVID-related concern, make sure that the reasonable accommodation process and your ability of being able to understand and document the interactive process in the COVID situation as employees return to the office, as well as you should have that in place anyway. That's an important process. Manage communications, ensure sufficient documentation, any and all termination or any and all human resources action. We strongly advise being able to have that in writing. One of the things that we do here, and depending upon how quickly things change on either the federal or the employee or the federal or the state situation, we issue employer advisories on a weekly basis to our ever-growing mailing list that Tom and I manage. And we share that information freely and without obligation for any services that you may be interested in learning about that we provide. Should you wish to get on the mailing list, please drop myself or Tom an email, and we can get that taken care of. And our contact information is it will be at the end of the presentation. Next slide, Tom. Here's where we're going to start seeing some of the, and this is where things have gotten a little crazy in terms of how things have changed right now, particularly around vaccinations. A couple of weeks back, we saw OSHA, we saw the CDC, and we saw New York State all being able to sort of trip over each other in terms of what are we going to do? How are we going to be communicating this? What are the rules and regulations that employers need to follow? This became such a hot topic that we actually issued an employer advisory on this very topic. Specifically, now that New York State has approached 70% of a vaccinated percentage, what do I need to be able to do? So that's an important thing to be able to be aware of. And we'll talk more about that when we start getting into the HEROES Act, that every New York State employer is going to have to actually put something in place between now and I want to say September. Timing and documentation, that's any human resources presentation that I'm sure you've attended or heard about, I think emphasizes the documentation aspect of any kind of contact you have with your employees rather. COVID is not the exception. And be aware of the new litigation landscape. And as I said, that's changing rapidly and regularly. Next slide, Tom. Well, here we go. And this is really where I wanted to just sort of talk about, well, what does this mean? Well, as of right now, New York State did reach the 70% vaccinated rate a couple weeks back. And as of right now, what does that mean? Well, New York State employers do remain subject to the guidance, which is CDC guidance and New York State requirements and OSHA guidance and New York State guidance, requiring them to prepare and maintain a written business safety plan to prevent the spread of COVID-19 in the workplaces. In New York State, that's called the HEROES Act, which is basically requiring employers to basically have a almost like an air safety plan in terms of being able to stop or to mitigate against the spread of airborne communicable diseases. More information is forthcoming on that. We've issued a couple of advisories on the HEROES Act, and we undoubtedly we're going to be issuing more. So that's, if you're not aware of that, you're going to need to be able to be aware of that. All of New York State's guidance specific to COVID-19 guidance is listed, and these links actually do work in this presentation. It's contained in what's called the New York Forward industry specific portion of their New York State Department of Health website. And it goes into specific guidance regarding social gathering limits, capacity restrictions, cleaning and disinfecting. And as I said, a lot of these have even further continued to be lifted. And as of right now, the big issue that people are grappling with, and I must get 5 phone calls a day on it, in terms of, well, what do we do? Do we verify if an employee has been vaccinated? Do we not verify if they're not vaccinated? Do we use the honor system? And so on and so forth. There's enough in that particular subject to cover a whole other presentation. You know, and as I said, I mean, being able to actually walk around and make, you know, and have people submit vaccination proof carries with it HIPAA concerns, carries with it concerns in regards to where that data is, how that data is handled, carries with it some concerns in regards to a manager perhaps getting or being told from an employee they choose not to be vaccinated, and all of a sudden that manager finds themselves in trouble because the employee is feeling, you know, I shouldn't be questioned in regards to why I'm choosing not to be vaccinated, and so on and so forth. We've advised our folks in terms of managing their workplace to go with an honor system whereby someone who's saying that they've been vaccinated, you know, we take them at that word. So that's, if anyone should have any questions on that, feel free to call me. That's a whole other series of policies and approaches that you need to be concerned about. The HEROES Act, again, as I said, all employers are going to have to comply with the HEROES Act mandates that require employers to create and implement an airborne infectious disease exposure prevention plan in accordance with forthcoming standards. The state has promulgated, or the state has promised to promulgate industry-specific standards that have not been released just yet. So we're continuing to monitor that, and we'll communicate that to everyone once that actually becomes more concrete. And as I said, the state continues to adhere to guidance for the Centers for Disease Control, CDC, which is currently stating that fully vaccinated individuals can refrain from masking and social distancing, with some notable exceptions. You know, correction facilities, homeless shelters, some healthcare providers. Unvaccinated individuals are responsible for wearing masks and maintaining social distancing, even in settings where the New York guidance has been lifted. The best way of being able to deal with this is we've actually issued a separate mask policy for clients to be able to use that sort of lay this out. And our clients are actually requiring their employees to acknowledge that. So it's basically covering, if you will, everything that we've just spoken about. If anyone would want a copy of that, we're more than happy to share it with you. Next slide, Tom. And once again, these are, and we're seeing most of these. I was shopping in my favorite supermarket the other day, and I was so happy to see that that they've reduced and eliminated the bidirectional foot traffic up and down the aisles. So that's all a result of New York State reaching the 70% vaccination mark. This is just a little bit of a summary in terms of what New York State employers are no longer required to maintain. And lastly, and I know some of our clients have gotten away from it, New York State did require early on in the COVID pandemic a daily questionnaire to be filled out. And before New York hit the 70% vaccinated mark a couple of weeks back, they reduced that. I think it was 5 questions or 6 questions. They reduced that to 3, and now they've actually eliminated that. So that literally all changed in the course of maybe about 7 days. So as I said, I've never seen anything move as quickly as it has in terms of people trying to grapple with ever-changing regulations. So we were happy to see that. Next slide, Tom. Nope, one more forward. So as of right now, and this is sort of the Governor Andrew Cuomo disclaimer that basically states that employers need to be aware that while he has not rescinded his executive order 202, which basically created a state of emergency last March 7th, 2020. It hasn't been officially lifted just yet prior to the July 5th, 2021 expiration. So I'm assuming it's going to be, but one never knows. So that's sort of where we're at as far as New York State is concerned right now. Next slide. And I went through that fairly quickly, but there's a lot of information in this presentation. Heather, I think, is recording this, and this presentation is available to you on the recording, as well as Heather. I'm sure they can can your membership access the presentation through the chamber?
So we're going to upload it to YouTube channel, and it'll be available there for our members to watch. Yes.
I'd like to open it up for any questions. We covered a lot of ground, and I hope I've covered it in a way that is not too boring, and I hope I just didn't go through too quickly the things that I spoke about. But if anyone's got a question, we're more than happy to take it.
We do have a question. Have you seen any attorneys attempt to aggregate these claims? Are they pursuing class certification as far as you can tell?
I've not seen class certifications just yet. I mean, we have been fortunate, and I'm gonna jinx myself here. And every time I say this to Tom always says, "Ed, please don't say this," but I'm gonna say it. We've been fortunate insofar that we've not seen, for all of our clients in over a year, we've not seen one COVID-related litigation claim being promulgated against any of our membership, or any of our clients, I should say. Whether that's luck or whether that our clients are reading our advisories, who knows? But in answer to your particular question, Jeremy, I've not seen claims being aggregated just yet. Now, the answer to even more specifically to your question is whether or not, with things like the HEROES Act, whether or not you're going to start seeing groups of employees come forward saying, look, my employer does not have a sufficient enough airborne protection standard. That's going to be a problem. So we have to keep a close watch on that one.
So we have a question about the HIPAA standards and what can an employer ask an employee as far as vaccination?
I mean, this is a topic that again, like I said, let me take it this way. An employer has a right to mandate vaccination. The EEOC has upheld an employer's right to basically say, I want based upon what my business is and what my business does, I want to be able to have my employees vaccinated. The problem that people run into in terms of being able to put that mandate out there is not giving an employee an option to be able to opt out of a vaccination for medical reasons, religious beliefs, or just an overall feeling that, hey, I don't want to be able to do this. So once again, if you're considering being able to do some type of vaccination program, please make sure that you've got proper policy documentation for that. And more importantly, more than anything, make sure that you have release agreements that basically communicate to your employees that you're giving them the option of opting out for religious reasons or other reasons that they're choosing not to be able to be vaccinated. Now,
that kind of goes into a second question then, Ed. If you are implementing a mandatory vaccination to existing employees, what do you do if they choose not to be vaccinated?
well, and again, according to state guidelines, just as I said on one of those slides, an employee who's choosing not to be vaccinated, is not released from maintaining proper social distancing and mask wearing in situations where social distancing can't be maintained.
So is the interpretation then that you can mandate it for new hires and request it for existing staff?
Well, you could, I mean, again, you could require new hires to submit to a vaccination that it's your policy. At that point in time, the new hire is in effect an employee, right?
Right.
So theoretically, you're saying this workplace adheres to vaccination situations. Where the original question was going, though, Heather, was in regards to the HIPAA situations. And again, as I said earlier, you're talking about, a vaccination is a medical record. It's a medical record. And as such, where those vaccination records are maintained, who maintains them, what the individual, how that information is being communicated, perhaps from maybe an internal human resources department to individual supervisors who've got a number of these employees in their departments. Those are all HIPAA concerns that really need to be fully vetted and fully communicated and fully uniform in terms of how those particular things are treated. So it's a very tricky subject, and it's a subject that is not precluded by law, but if it's not handled correctly, it can become very unwieldy very quickly in terms of my supervisors questioning why Ed's not vaccinated and Tom is, or my supervisors questioning is where's Tom's documentation? He says he's vaccinated, but we know he's not. These are all the kinds of things that come into play as you try to grapple with this. Like I said, the biggest thing that I think people need to do and be aware of is making sure that you've got a workplace mask policy, making sure that you understand what the interactive process is pertaining to an individual who says, look, I don't want to wear a mask. I can't wear a mask. I've got a problem wearing a mask. What do I need to be able to do as far as that's concerned? And if you do go down that path of wanting to be able to make sure that you've got proper documentation pertaining to a workplace mask policy, make sure you've got the disclaimers in there that allow your employees to opt out of it. And like I said, if anyone needs those templates, we have them, and we're more than capable of being able to provide them to you.
Thank you so much. I appreciate both you and Tom's time. It doesn't look like we have any other questions. Just
Okay.
a reminder that we have some upcoming events at the chamber. So we have our monthly membership breakfast on the 8th, and that will be at Winding Hills. We are now completely live, no more hybrid. The topic will be why Orange County, focusing on both economic development and why are people choosing to come to Orange County, that escape from NYC that we saw so prevalently last year. Also, we have on the 15th, our mixer at Equilibrium Brewery. So please join us. Watch out for our Business Essentials Network monthly lunch and learns, as well as our workplace wellness lunch and learns. And in about an hour, you can join me for the Meet the Member with New Beginnings, Windows and Doors. Thank you so much. Thank you again, Ed and Tom. We appreciate you donating your time to make sure that our members are compliant with all of this.
And Heather, if I could just quickly, our contact information is area code 845-471-1200. If anyone's got follow-up questions or need anything further, we're more than happy to help.
And as always, you can reach out to me at the chamber and I will put you in contact as well. Thanks so much, everyone. Have a great day. Stay cool.
Bye, Heather.
Bye-bye.